And joining us now from Port Sudan is Dr. Shible Sahbani, who the WHO's representatives to Sudan and the head of mission. Thank you very much, sir, for joining us. Now, the World Health Organization says the crisis in Sudan could worsen in the coming months as the distribution of humanitarian aid and medical supplies remain restricted. How bad is the situation on the ground, and what are some of the avenues being explored to increase the distribution of aid? And also, is that even possible, especially in areas that are most affected?
Yeah, okay. Since we are celebrating, sadly, the 1 year after the onset of the crisis in Sudan, saying that the situation is grave would be an understatement. You know that 50% of Sudan's 51 million population now require humanitarian assistance, and out of them, 14.7 million people require urgent health needs. Almost 8.6 million people displaced due to the conflicts make Sudan one of the largest, if not the largest, displacement crisis in the world today. 6.6 million are displaced internally, making up 13% of all internally displaced people. Which makes 1 of every 8 displaced persons over the world are Sudanese. So regarding the health situation in the country, we have 106,000 children who have severe acute malnutrition. Outbreaks, there are so many outbreaks ongoing, including cholera, dengue, malaria. And we have 12 states out of the 18 states who have a combination of at least 3 of these outbreaks. With this situation, the health system is really weakened due to the conflict. And you know that the health system in Sudan was struggling even before the conflict. So 80% of the health facilities in conflict affected areas in Sudan, and 45% in 5 states affected by the conflict are no longer functional. In addition to that, we note that there is a violation of the international humanitarian law, with many health facilities being targeted, health workers being targeted, even ambulances, and this number may be higher if we access the other areas. Now, to answer also the second part of your question, yes, conflict-affected states like Darfur, Kordofan, Khartoum, Al Jazeera, they are the most affected as they are hard to reach. And some of these places have run out of medical supplies with no safe access to replenish them from our side. In addition to that, insecurity, bureaucratic hurdles, make it difficult to get medical supplies to where they are needed in time. So WHO with its partners are trying to bring the supplies and the health support, the urgent health support needed through different areas, including cross-line and cross-border operations.
Okay, so let me pick up on that, because you've highlighted some of the states such as Darfur, Kordofan, Al Jazeera, states that are still affected by the ongoing conflict. Could you share with us how organizations such as yours, the World Health Organization, are working to get aid to those who need it most, especially in such conflict-ridden areas, and what else you think can be done?
Yeah, you are right. Despite all these challenges on the ground, that given the urgent health needs, the World Health Organization has supported essential life-saving services, including cholera case management, oral rehydration points, reaching over 350,000 people. From August of last year, August 2023, until January 24, 3.3 million IDPs received life-saving treatments. And we've set up with Ministry of Health, Sudan Ministry of Health, 32 temporary mobile clinics all over the country. In recent campaigns supported by WHO and UNICEF in a very good and fruitful partnership, 5.7 million people in 7 states were vaccinated against measles, against rubella, and 4.5 million persons aged 1 year and above were vaccinated against cholera. WHO has also delivered over 1,000 metric tons of medical supplies to Sudan to meet the urgent health needs through direct flights from different hubs, but also through cross-border and cross-line operations, including from Chad and from South Sudan for the time being. In addition, WHO's and other partners' capacity to address the urgent health needs of the 4.9 million people depends on the capacity to operate through cross-line and cross-border operations, including delivery of essential services and outbreak surveillance and response. But this is limited by the different bureaucratic issues, but also the capacity to operate from the neighboring countries. I would like to seize also this opportunity to thank our donors and partners for their support to help meet the urgent needs in Sudan. And we call really for renewed commitments to the people of Sudan from every single stakeholder.